Hello, welcome to Leading Characteristics Part 5. In Brief Talk 2, we discussed about the use of Arnica montana in injuries in the different types of traumas. Today in leading Characteristic 5, I will discuss about the leading characteristics of Arnica. Apart from injuries, Arnica is also used in many systemic diseases also. So, how to use it? What are the leading characteristics? We will talk today. Number one, we mentioned it in injury cases also, that it has a tendency, does not wish to be approached because he does not wish to enter into conversation. Number one, and number two, he does not wish to be touched on account of great bodily soreness. So this is number one. He does not wish to be approached. Number one symptom. Number two, sore, lame, bruised feeling or pain as if beaten. Whatever disease he comes, this has to be there. Number three, after trauma that we have already discussed, that is after any blunt injury or bad effect after a blunt injury. Then number four is Arnica patients, they have nightmares and they have horror during the night. They suddenly wake up holding their chest, the region of the heart, in fear. This is number four. We have to remember, full of nightmares, dreadful dreams. Number five, often used in delirium, delirious fevers. Number six, remember, prostration. Arnica patient has prostration. We have other remedies, we know. Arnica 2 has prostration. Number seven, Arnica has free bleeding. They bleed very easily. Number eight, they are restless. Restless due to soreness. Number nine, they have offensive discharges. Arnica patient, mainly the stool, the platters offensive. And number 10, remember, heat of upper part of the body and coldness of lower. So these 10 points, 10 leading characteristics, if we remember, particularly the first five. Now I will repeat again. Number one was does not wish to be approached, does not patient, Arnica patient, in any case of disease. It can be typhoid, it can be any other fever, it can be a case of pregnancy, it can be a case of uh, dry cough or a whooping cough or pneumonia or anything, any meningitis. The patients will never wish to be approached. Why? Two reasons. One, he does not wish to enter into conversation. A mental state, he does not wish to enter into any conversation. Number two, he does not wish to be touched. This is important. In injury cases also, if we see the patient that sore bruised feeling, he will not let the doctor or anybody touch the part. That pain, that soreness, he will not wish anybody to touch on account of that great bodily soreness. This is found even in systemic diseases. So this number one we should remember, does not wish to be approached. Number two, the sore bruised feeling. That is after any fever. It can be found in any septic, any typhoid fever, in pneumonia case, or any other disease. If such soreness is found, sore, lame, bruised feeling, it is feeling as if he has been beaten. His muscles sore, pain, as if he has been beaten. Then we will think of arnica. There are other remedies also. In rickettsia we have soreness. In ruta we have soreness. But arnica is the leading. Number three, after traumas, that is blunt injury we discussed earlier in brief talk 2, or bad effect after blunt injury. Now, the action over muscles, bones, in blood circulations, these are Arnica's place of action: bones, muscles, and blood circulations, blood vessels, not the nerves. This has to be remembered. If there is nerve pain, other set of remedies like ledum, hypericum come. Now, not just physical trauma, also mental, we have discussed already. Number 4, full of nightmares. Dreadful dreams we find in a typhoid case of arnica. They have full night dreams, dreadful fears. They rise up again. They fall back to sleep. We find this even in opium. After an accident or in a typhoid case, opium patient also, they undergo anxiety, fear of death. They rise up at night, holding their chest, be having fearful dreams. But the difference is that arnica patients do not do it in daytime. During the daytime, they are normal. But the opium patient, the fear continues even during the daytime. This is the difference. Number 5, in delirious fever, arnica is very important drug. Some very important, interesting characteristics it has. Number 1, in delirious fever, if we rise the patient from a stupor, if he is roused, if on seeing the doctor he says, "I am well, doctor, go away. I did not need you, do not need you." So he says to the doctor, "I do not need you, just go away, I am quite well." Now, why he says so? We find opium patient also says so. What is the difference? Arnica says so because he does not wish to be approached, or does not he wants to be left alone. So it is a mental state where he wants to be left alone. He does not want to be bothered. So arnica patient will say in delirium, if he sees the doctor, if he is roused from his stupor, he will say, "Just go away, I don't leave me alone." But opium also says that I am quite well, I am quite fine. Though he is having very high temperature, maybe he had vomited uh, blood, and the condition he is very, his appearance is very bad. But still the opium patient will say, "I'm fine, I do not need any doctor." Why? The opium, what happens, that they have painlessness. That is a very characteristic of opium. They do not feel any pain, any sore, and their mental state is in a lack of, what I will say, lack of awareness, a lack of sensitiveness. So he says so. Now, another feature of arnica in delirium is that it is very striking. If he is roused from his sleep, from his stupor, and asked a question, he completes the question. He completes the answer of the question and then goes back to delirium again babbling in all nonsense things in his confusion. So this delirious state, though he is in delirium, when he is asked a question, he consciously answers and completely correctly answers the question, and then again goes back to delirium. This is very striking in arnica. Here we find a difference with bacteria. In bacteria, the patient, if he is roused and asked a question, he won't be able to complete it. There are other striking differences I will tell in the end. Now this is and one two things. Another is passing involuntary stool. So in delirium, remember Arnica. One, he will say, "I am quite well. No need. I don't need a doctor." Number two, if he is asked a question, he will be conscious from his delirium. He will answer correctly and completely, and then again goes back to delirium and passing involuntary stool. These three things you must remember. Along with all these features, as I told, there is prostration with any type of fever or any type of other bodily ailment. We will find prostration in arnica. We think of when we think of weakness, we remember arsenic, we remember carbovage, muriatic acid, even acid phos, other remedies. But arnica has prostration. We should not forget. So next is bleed easily. Arnica has a tendency, it acts on the blood vessels and it relaxes the blood vessels. Due to that reason, arnica patients bleed easily. We find often when there is a hematuria or nose bleeding, if arnica is given, any systemic uh, hemorrhage is taking place, arnica is given, it acts as a, it immediately helps to stop the bleeding. This is because it has a tendency to bleed. So it is bleeds easily. Arnica in any other disease, if you find like in cough, in pneumonia, if he is having hemoptysis, arnica patient will have that hemoptysis. Or in typhoid, he may pass blood with stool, melena. Number 8, restlessness. Now this is due to the Rustox has the restlessness, Arnica has restlessness due to soreness. One the side of the bed or the side of the body he is lying, he will have pain. So he will change position, go to another, lie on another side. Again that side will be sore. He will again change like this. He keeps on changing, and he will say one thing that the bed feels very hard. The bed feels very hard. This is the we find in arnica. Other remedies also say this, but arnica has this important characteristic. Number 9, offensive discharges. The stool, the platters, the eructations, sometimes even the sweat. And number 10, heat of upper part of body and coldness of lower part. Now these 10 characteristics, if you remember, especially the first five, six characteristics, that sore, lame, bruised, pain as if beaten, does not wish to be approached, does not wish will not allow anybody to approach, history of trauma, then nightmares, dreadful dreams at night, prostration and offensive discharges, passing involuntary stool in delirium or in any other case also. These things we should remember arnica, restlessness due to soreness. Now, it is used in different types of maladies. Like we use it in gout, we use in retinal or conjunctival hemorrhage. It can be due to injury also, due to systemic cause also. Retention of urine after labor, retention of urine after overexertion or concussion on the brain. We have discussed earlier, brain concussion, trauma. From there, if there is retention of urine, we think of arnica. Extreme soreness in whole body, particularly pelvic region or in pregnancy. If we find extreme soreness in whole body, particularly in the pelvic region during pregnancy, and the patient is sensitive to the motion of the fetus and cannot sleep at night, we think of arnica. In hemoptysis, pneumonia, in melena, in typhoid fever, in postpartum hemorrhage also, after the childbirth, if a large childbirth, there is a mechanical injury definitely in the muscles, and due to that, if there is hemorrhage, postpartum hemorrhage, we think of arnica. So these are different things. Now, where we will need arnica. Now, its difference with opium. Often there is a similarity we find with opium. Both have anxiety, both have horror, dreadful night, uh, dreams during the night. Both are very prostration. Both have. But in Arnica Montana, this dream or horror we see only during the night. It is not during the day. But the opium patient, they are always throughout the day. They are in anxiety. They are in fear, in stupor. Both the patient I discussed earlier that they say that I am well and fine. Arnica says so because due to shock, he wants to be left alone. He does not want to be bothered, and opium says because of painlessness due to lack of realization, lack of I will say inactivity of the senses. Due to inactivity of the senses, due to lack of realization, due to painlessness, they say, yes, I am fine, I am not feeling bad. This is opium. Difference with baptisia often comes in typhoid fever. What are the difference? In both baptisia, they both have sore bruised feeling, they both feel the bed hard, they are both restless, they both have delirium, but the baptisia offensiveness is much greater, very, very extremely offensive. The sweat, the urine, the stool. If the doctor enters into the bedroom of the patient, from the door he will feel the offensiveness. Arnica not so offensive. Second, if he is asked a question, Arnica will complete the answer, delirium won't complete. So these two things we should remember. And another thing, the Arnica patient, they pass involuntary stool in delirium. This is more marked in Arnica. In Baptisia, we won't find. Now, these are the some useful points we should remember about Arnica. And another thing which I forgot to tell in brief talk too, I talked about its use in injuries. Another injury very important, that is its use in stroke, in cerebral stroke. Arnica montana, until and unless you are sure about the acute cause of the stroke, as I mentioned, aconite, from fear, sudden fear, a stroke takes place, aconite is a good remedy. There can be any other remedy, but if you are not sure of the cause, then the first remedy is we should think Arnica montana in a very high potency. One single pill dose, Arnica montana in very high potency. The patients, they should consult their visiting homeopath doctors, those who to those who they go, they should consult the doctor, and they can keep handy a high potency of arnica so that it can come to use as an emergency medicine during stroke. This is all for arnica. Thank you so much. We'll meet you again with another medicine.